So, what causes type 2 diabetes? Here you can see several risk factors that increase a person's likelihood that they will develop type 2 diabetes. Anyone who has prediabetes is more likely to develop type 2 diabetes. Having overweight or obesity increases your risk, as does age, so anyone 45 years or older. Having a parent, brother, or sister with type 2 diabetes, being physically active less than 3 times a week, and ever having gestational diabetes will all increase your risk of developing type 2 diabetes. Some racial and ethnic groups are also at a higher risk of developing type 2 diabetes as well. You'll notice that some of the things on the last slide can't be changed and others can be. And we're going to focus in this class on the things that we can change to reduce our risk of developing type 2 diabetes or to manage our condition better. Several of them are related to our behavior and our habits. You can prevent or delay type 2 diabetes with simple, proven lifestyle changes like losing weight if you're overweight, eating healthier, and getting regular physical activity. Something else to note is that people who smoke have a much higher risk of developing type 2 diabetes, and if you smoke while you have type 2 diabetes, you're more likely to develop complications. So based on all of that, we know that we can do something about our risk for diabetes, and we can also do something to manage diabetes if it's been diagnosed already. You can do this by making healthier food choices, which we'll talk about in the second session, by exercising, and possibly by taking medications depending on what your healthcare team prescribes you. Losing just a small amount of weight can cut your risk of developing type 2 diabetes nearly in half. For those who have been diagnosed with type 2 diabetes, there is a lot you can do to manage the disease and limit complications down the road. For the rest of this class, we will focus on better management of diabetes. So let's take a closer look at the symptoms of type 2 diabetes and how it's diagnosed. Symptoms of type 2 diabetes are often subtle or silent in the early stages and can go undiagnosed or unnoticed. Some symptoms that are common are increased thirst, more frequent urination or needing to go to the bathroom often, feeling more tired than usual or having blurred vision, more frequent infections or slow healing wounds, and then unexplained weight loss. Some people have mistaken these symptoms before for other things like summer heat or just aging, so it's important to have regular checkups with your doctor so that they can be assessing whether or not you have type 2 diabetes. Symptoms of type 2 diabetes typically do not occur until blood glucose levels are at dangerously high levels. There are 3 different types of tests that are typically run in the diagnosis of type 2 diabetes. The first listed here is hemoglobin A1C, which is abbreviated to HbA1c. You'll hear me call it A1c. This is a blood test that measures your average blood sugar level over a period of 2 to 3 months. Fasting plasma glucose checks your blood sugar when you haven't eaten anything to assess what your blood sugar level is at one point in time. Most often, the oral glucose tolerance test, sometimes called the OGTT, is commonly used to diagnose diabetes. It's a 2-hour test that measures your blood sugar and how it changes after you've drank a really sugary drink. Most people with diabetes should see their healthcare team at least twice a year for regular checkups and laboratory tests. Although the guidelines need to be individualized, most people with diabetes are advised to have a blood test to measure A1C and a blood pressure check every 6 months. Some people with diabetes are advised to have an A1C test more often if their condition is not well controlled, closer to about every 3 months. So now we'll look at the different ranges for these lab tests. Here on the left, you can see the A1C test. At a level of 5.7 to 6.4, someone is considered to have prediabetes. When an A1C test value is 6.5% or greater, that person is considered to have type 2 diabetes. Anything less than 5.7 is considered normal. For fasting plasma glucose, a test result greater than 126 milligrams per deciliter is a sign of type 2 diabetes. And for the oral glucose tolerance test, a result of 200 milligrams per deciliter or greater is indicative of type 2 diabetes. So here we'll take a closer look at what the A1C test means. The blue dots here represent sugar, and the red disc represents a red blood cell. It's normal to have a little bit of sugar present on the surface of your red blood cell. Over a span of 2 to 3 months, some of these little sugar molecules are going to get stuck to the outside of a red blood cell. The A1C test is looking at exactly how much sugar is stuck to the outside of your red blood cell. With diabetes, blood sugar is going to be running higher than it should be, and so it's more likely that sugar will get stuck to the outside of your red blood cell. So the picture on the left shows a normal A1C level, less than 5.7%. And here on the right, you can see a high A1C level. And clearly there are a lot more sugars stuck to the outside of the red blood cell. So this is just a visual representation of what the A1C test is telling you.